Prometric Q and A and Rationals 261-280. 261. A client experiencing acute respiratory failure will most likely demonstrate 1. Hypocapnia, hypoventilation, hyperoxemia. 2. Hypocapnia, hyperventilation, hyperoxemia. 3. Hypercapnia, hyperventilation, hypoxemia. 4. Hypercapnia, hypoventilation, hypoxemia. Answer: 4. Acute respiratory failure is marked by hypercapnia, elevated arterial carbon dioxide, hypoventilation, and hypoxemia, subnormal oxygen. 262. A client with clinically active pulmonary tuberculosis is ordered isoniazid, rifampin, pyrazinamide, and ethambutol. Which findings best indicate effectiveness of drug therapy? 1. Cavities are no longer evident on chest X-ray. 2. Tuberculin skin test is negative. 3. The client is afebrile and no longer coughing. 4. The sputum culture converts to negative. Answer: 4. A change in sputum culture from positive to negative is the best indication of the effectiveness of antitubercular medication. Cavities disappearing from the chest X-ray aren't a reliable indicator of drug effectiveness. Tuberculin skin tests don't convert from positive to negative. Disappearance of symptoms isn't the best indicator of the treatment's effectiveness because the causative organism may still be present. 263. Following pneumothorax, a client receives a chest tube attached to a 3-chamber chest drainage system. During the night, the client becomes disoriented, gets out of bed, and steps on the drainage device, causing it to crack open and lose its seal. The nurse should immediately 1. Clamp the chest tube close to the client's thorax. 2. Attach the chest tube directly to low wall suction. 3. Place the device on a sterile field and call the physician. 4. Place the end of the chest tube in a container of sterile water. Answer: 4. When a chest drainage system cracks open, the closed system between the pleural space and the device is broken. This will allow air to move through the tubing into the pleural space, exacerbating the pneumothorax. The nurse should immediately place the distal end of the tube in sterile water, closing the system again. The tube shouldn't be clamped because doing so increases pressure against the pleural space. It's inappropriate to attach the drain directly to wall suction because doing so may cause too much suction to the pleural cavity. Calling the physician should occur after correcting the problem. 264. A nurse is preparing a client with systemic lupus erythematosus for discharge. Which instructions should the nurse include in the teaching plan? Exposure to sunlight will help control skin rashes. There are no activity limitation between flare-ups. Monitor body temperature. Corticosteroids may be stopped when symptoms are relieved. Answer: 3. The client should monitor his temperature because fever can signal an exacerbation and should be reported to the physician. Sunlight and other sources of ultraviolet light may precipitate severe skin reactions and exacerbate the disease. Fatigue can cause a flare-up of systemic lupus erythematosus, and clients should be encouraged to pace activities and plan for rest periods. Corticosteroids must be gradually tapered because they can suppress the function of the adrenal gland. Abruptly stopping corticosteroids can cause adrenal insufficiency, a potentially life-threatening situation. 265. The nurse is administering didanosine, Videx, to a client with acquired immunodeficiency syndrome. Which intervention is most appropriate? 1. Crushing the tablets and mixing them with fruit juice. 2. Instructing the client to swallow the tablets whole with water. 3. Telling the client to chew the tablets thoroughly before swallowing. 4. Dissolving the tablets in fruit juice. Answer: 3. Didanosine is an antiretroviral drug, reverse transcriptase inhibitor, that's given to treat human immunodeficiency virus infections. Didanosine tablets contain buffers that raise stomach pH to levels that prevent degradation of the active drug. Tablets must be chewed thoroughly before swallowing. They may also be crushed and mixed with water. They shouldn't be added to fruit juices or other acidic liquids. Tablets may be dispersed in a non-acidic liquid for administration. Didanosine tablets aren't taken whole. 266. A client with thrombocytopenia, secondary to leukemia, develops epistaxis. The nurse should instruct the client to lie supine with his neck extended. Sit upright, leaning slightly forward. Blow his nose and then put lateral pressure on his nose. Hold his nose while bending forward at the waist. Answer. 2. The upright position, leaning slightly forward, avoids increasing the vascular pressure in the nose and helps the client avoid aspirating blood. Lying supine won't prevent aspiration of the blood. Nose blowing can dislodge any clotting that has occurred. Bending at the waist increases vascular pressure in the nose and promotes bleeding rather than halting it. 267. The nurse is preparing to administer iron dextrin, Impherin, to a client with iron deficiency anemia. Which action is appropriate? 1. Using a 25G needle. 2. Administering a zig-zag injection. 3. Using the same needle to draw up the solution and to administer the injection. 4. Preparing the deltoid site for injection. Answer. 2. A zig-zag or zigzag technique should be used to administer an iron injection. This prevents iron from leaking into and irritating the subcutaneous tissue. A 25G needle is used for a subcutaneous injection, not for a deep IM injection, such as that needed to administer iron. The needle should be changed after drawing up the iron solution to avoid staining and irritating the tissues. A deep IM site, such as the upper outer quadrant of the buttocks, should be used to administer iron. The deltoid site doesn't provide enough muscle mass for an iron injection. 268. A nurse is reviewing the laboratory report of a client who underwent a bone marrow biopsy. The finding that would most strongly support a diagnosis of acute leukemia is the presence of a large number of immature 1. Monocytes, 2. Thrombocytes, 3. Basophils, 4. Leukocytes. Answer. 4. Leukemia is manifested by an abnormal overproduction of immature leukocytes in the bone marrow. An increased number of monocytes may result from a viral infection. An increased number of basophils may result from an allergic reaction. A large number of thrombocytes indicates polycythemia vera. 269. A nurse is administering cyanocobalamin, vitamin B12, to a client with pernicious anemia, secondary to gastrectomy. Which administration route should the nurse use? 1. Topical route. 2. Transdermal route. 3. Enteral route. 4. Parenteral route. Answer. 4. Following a gastrectomy, the client no longer has the intrinsic factor available to promote vitamin B12 absorption in his GI tract. Vitamin B12 is administered parenterally, IM or deep subcutaneous. Topical and transdermal administrations aren't available, and the enteral route is inappropriate in a gastrectomy. 270. A nurse is providing care for a client with acquired immunodeficiency syndrome, AIDS, and pneumocystis pneumonia, PCP. The client is receiving aerosolized pentamidine isethionate, Nebupent. What is the best evidence that the therapy is succeeding? 1. A sudden gain in lost body weight. 2. Whitening of lung fields on the chest X-ray. 3. Improving client vitality and activity tolerance. 4. A febrile body temperature and development of leukocytosis. Answer. 3. Because a common manifestation of PCP is activity intolerance and loss of vitality, improvements in these areas would suggest success of pentamidine isethionate therapy. Sudden weight gain, whitening of the lung fields on chest X-ray, and leukocytosis aren't evidence of therapeutic success. 271. A nurse is documenting her care for a client with iron deficiency anemia. Which nursing diagnosis is most appropriate? 1. Impaired gas exchange. 2. Deficient fluid volume. 3. Ineffective airway clearance. 4. Ineffective breathing pattern. Answer: 1. Hemoglobin is responsible for oxygen transport in the body. Iron is necessary for hemoglobin synthesis. Iron deficiency anemia causes subnormal hemoglobin levels, which impair tissue oxygenation and impair gas exchange. Iron deficiency anemia doesn't cause deficient fluid volume and is less directly related to ineffective airway clearance and breathing pattern than it is to impaired gas exchange. 272. A nurse is caring for a client with dysphagia. Most likely, the client has experienced damage to the 1. Frontal lobe, 2. Parietal lobe, 3. Occipital lobe, 4. Temporal lobe. Answer: 4. The portion of the cerebrum that controls speech is the temporal lobe. Injury to the frontal lobe causes personality changes, difficulty speaking, and disturbances in memory, reasoning, and concentration. Injury to the parietal lobe causes sensory alterations and problems with spatial relationships. Damage to the occipital lobe causes vision disturbances. 273. A client is hospitalized with a possible diagnosis of Guillain-Barré syndrome. When collecting history data from the client, the nurse should ask: 1. Do you bruise easily? 2. Have you had an upper respiratory tract infection recently? 3. Have you been out of the country during the past 4 months? 4. Has anyone in your family ever had Guillain-Barré syndrome? Answer: 2. About 60% to 70% of clients with Guillain-Barré syndrome experience upper respiratory or GI viral infection 1 to 4 weeks before symptoms begin. The exact cause of Guillain-Barré syndrome is unknown, but it may be a cell-mediated immune response that attacks the peripheral nerves in response to a virus. The major pathologic effect is segmental demyelination of the peripheral nerves, which destroys the myelin sheath of the nerve. Guillain-Barré syndrome doesn't affect the clotting cascade, isn't related to exposure during foreign travel, and isn't a hereditary disorder. 274. A nurse is teaching a client and his family about dietary practices related to Parkinson's disease. A priority for the nurse to address is the risk of 1. Fluid overload and drooling, 2. Aspiration and anorexia, 3. Choking and diarrhea, 4. Dysphagia and constipation. Answer: 4. The eating problems associated with Parkinson's disease include dysphagia, aspiration, constipation, and risk of choking. Fluid overload, anorexia, and diarrhea aren't problems specifically related to Parkinson's disease. Drooling occurs with Parkinson's disease, but doesn't take priority. 275. In some clients with multiple sclerosis, MS, plasmapheresis diminishes symptoms by removing 1. Catecholamines, 2. Antibodies, 3. Plasma proteins, 4. Lymphocytes. Answer: 2. In plasmapheresis, antibodies are removed from a client's plasma. Antibodies attack the myelin sheath of the neuron, causing MS symptoms. Plasmapheresis isn't for the purpose of removing catecholamines, plasma proteins, or lymphocytes. 276. A client undergoes a surgical clipping of a cerebral aneurysm. To prevent vasospasm, the nurse should anticipate administering 1. Diuretics such as furosemide, Lasix, 2. Blood products such as cryoprecipitate, 3. The calcium channel blocker nifedipine, Procardia, 4. Volume expanders such as crystalloids. Answer: 4. To prevent vasospasm following repair of a cerebral aneurysm, treatment focuses on increasing cerebral perfusion. This increase can be accomplished by giving volume expanders such as crystalloids. Diuretics would decrease cerebral perfusion by reducing volume. Cryoprecipitate isn't used as a volume expander. Nimodipine, not nifedipine, is the calcium channel blocker indicated for use in cerebral vasospasm treatment and prevention. 277. A client is diagnosed with a brain tumor. Palliative care is all that can be offered to the client. In addressing the client and family, it would be most therapeutic for the nurse to say: 1. I'm sorry. I wish there was more we could do. 2. Be optimistic. Others have survived equally as grave situations. 3. I understand this situation is distressing and I want to help. 4. Be thankful you and your family have each other for support during this time. Answer. 3. Initially, the client and family may be in shock and disbelief. They need the nurse's understanding, support, and offer of help. Apologizing communicates pity. Telling the client and his family to be optimistic gives false hope. Telling them to be thankful they have each other for support communicates detachment. 278. A nurse is teaching a client with a T4 spinal cord injury and paralysis of the lower extremities how to independently transfer from bed to a wheelchair. When transferring, it's important for the client to move 1. The upper and lower body simultaneously into the wheelchair. 2. His upper body to the wheelchair first. 3. His feet to the wheelchair pedals and then his hands to the wheelchair arms. 4. His feet to the floor and then his buttocks to the wheelchair seat. Answer. 2. The proper technique in transferring from a bed to a wheelchair when there is paralysis of the lower extremities is to move the strong part of the body to the chair first. The client should move his upper body to the wheelchair first and then move his legs from the bed to the wheelchair. Other techniques are less safe and can endanger the client. 279. A client who recently underwent cranial surgery developed syndrome of inappropriate antidiuretic hormone, SIAD. The nurse should anticipate that the client will 1. Experience edema and weight gain. 2. Produce excessive amounts of urine. 3. Need vigorous fluid replacement therapy. 4. Have a low urine-specific gravity. Answer. 1. SIAD is an abnormally high release of antidiuretic hormone causing water retention, which leads to edema and weight gain. Urine output is low, fluid is restricted rather than replaced, and the urine-specific gravity is high. 280. A nurse is providing care for a client following surgery to remove a cataract from the right eye. In which position should the nurse place the client? 1. Right side lying. 2. Prone. 3. Supine. 4. Trendelenburg's. Answer. 3. Positioning the client on his back or unoperative side prevents pressure on the operative eye. Operative side lying or prone position may put external pressure on the affected eye. Trendelenburg's position may increase intraocular pressure.